Well, hello everybody, and a very warm welcome to the second WebEx in our Virtual Academy of Large Scale Change webinar series. My name's Elaine Bayless, and I'm a Senior Improvement Manager in the Sustainable Improvement Team in NHS England, and I'll be one of your facilitators today, helping our guest speaker as we kind of navigate through the next hour on leading large scale change. Now, I'm not going to be alone in supporting you, so please do meet the team. Helping us with the WebEx today are my colleagues Ian Smith, Michael Anderson, and missing actually from the photos, Jane Whitten, who will be helping to monitor the chat box. And we're hoping to make this session really interactive, so please do join in. Let us know who you are. If you haven't said hello already, please do say hello in chat. Let us know where you're joining us from and what you're interested in large-scale change. What are you up to out there? It'd be really great to know a little bit about our audience. And we also have helping us today, and probably the most important person on this WebEx, Rachel Gray. Rachel will be dealing with all things technical. So if you have any issues with listening into the WebEx or have any questions, please do drop a note to Rachel in the chat box and she'll do her best to help you. Thanks, Rachel. You'll probably get inundated with requests now. If you are using the chat box, can you please make sure in the Send To box you select all participants, and that will enable everybody on the session today to get involved in what you're saying, and so we can start to build a nice little community of interest amongst ourselves and to share stories with one another. Okay, we will have a few minutes for questions at the end, but anything else that's on your mind, let us know in chat as we're going through. Okay, so today our guest speaker is Ali Wheeler. Absolutely excited about today's session. Ali's been leading large-scale change for many years now, haven't you, Ali? And has a full history in the public sector. So a little bio about Ali is on your screens now. But I know she gets dead embarrassed about that part, so I'm going to flick over really, really quickly. And Ali, if I hand the ball over to you, the floor is yours.
Thank you very much. Good afternoon, everyone. It's absolutely lovely to see you all logging on, and really enjoying seeing where you all are, all over the UK, from lots of different organisations, transformation teams, delivery teams, prison pharmacy. I can see you all, so lovely to see the interaction already. So I've got about an hour to spend time with you this afternoon. Like Elaine said, I'd really like it to be interactive, and we're going to be stopping every so often to talk about, to ask you questions, to share some thoughts and ideas, and I would really encourage you afterwards to have a look back over the chat so you can all link in together, because this is definitely about building networks up between us. So what am I going to talk about today? So as Elaine introduced me, I went on the first large-scale academy for large-scale change. I've been a practitioner, a coach, a trainer, and I'm about to go back into a transformation team within the NHS to lead a large-scale change programme. So what I'd like to share with you today is why do I think that we are dealing with wicked problems? Why do we call them wicked problems? Why is large-scale change wicked? Give you an overview of large-scale change in the model, and share large-scale change with you in action, going right back to the beginning when I used it as an example. But I really believe that large-scale change is learnt in action, and I'd love to hear some of your thoughts on that as we go through this. Identify some of the core elements of large-scale change, so that we can introduce you to the masterclass series where you can learn about them in more detail and share some of the lessons learned. So I hope you find that really interesting in the next hour and are able to stay with us. So do you have a wicked problem? Are you sat there at your desk now, wherever you're sat, or wherever you're watching this thinking, I am dealing with a really wicked problem? Or see people say that I'm dealing with a wicked problem, and why is that? Well, these are my thoughts. I think that transformational changes really are wicked problems, and the reason for that is that they often have multiple and competing goals. So we're not just talking about a linear change program here. We've got layers upon layers upon layers of changes that need to happen, and they often compete with each other, and therefore that creates a challenge for us. Large-scale change programs, transformational change programs, systems change, whatever you want to frame it as, are really complex. The difference between complex and complicated for me is quite simple in my mind. Complicated, we know the end point. We know it's going to be really hard work to get there, but we know how we're going to get there. It's just going to take time, and it's complicated along the way. Whereas transformational change, I believe, is complex because we don't necessarily need to, we can't necessarily predict the end outcome. It's going to be difficult and challenging along the way. We don't necessarily know the complete and direct route how to get there. And why is that? Because it is going to be emergent, and that's the exciting part, and it involves people. And we are all creatures of our own values, and we are driven by different motivations and areas of work, and we're all in different organisations, and therefore not only us but the public out there as well, our patients, our carers, our communities, they're all involved in this really complex change. That's why it's wicked in my mind. I'd love to hear more from you on that as we go along. So having put all that out there, I'd like to do our first interactive bit. I'd really like to hear from you in this poll, and this is where I'm going to call on Rachel in a minute. And based on the 3 areas which I've put out there about why I think that transformational change is complex, I'd really like to understand from you which is the most challenging area to you at this moment in time. So if it's multiple and competing goals, or if it's because it involves people, or if you can't predict the outcome yet, I'd really like to know which is the most challenging area for you. And Rachel, can we bring up the poll? And this is the interactive part out there with all you participants today. I'm going to give you about 30 seconds to start to record your answers. And I know that somebody in the chat box is definitely going to say all 3, and that's brilliant if you do. But can you choose one? Can you choose one of all 3? Because the reality is all 3 are probably giving you a challenge, but which one is most challenging to you? So, Rachel, how are we getting on with results? Have we got some results coming up?
We have indeed. If we could just give folk another 10 seconds perhaps, just to make sure that they've got some answers in there, but we're pretty on the way for getting a good completion rate.
Brilliant. You're being very generous today. Okay. So that's superb. Let's have a look. The poll's ended, and let's have a look at some of the results. Wow. That's brilliant. So from that, I think 36% of you are saying that the challenges to you are multiple and competing goals. Brilliant. 29% of you are saying it's involving people. That's really interesting, and we can pick that up along the way. 11% is you can't predict the outcome yet. So is that because you're comfortable with the fact that you're in that space and it's not giving you a challenge, and that people are allowing you to work in that emergent way? That would be really interesting to unpick. And 24 of you either didn't have time or were still contemplating your ideas. So that's brilliant. So we're definitely coming at this from the same space, that we're all working with complex challenges in what we're talking about. Can we clear that poll, Rachel? Is that okay? And then I can move on. There we go. Okay, so what is large-scale change? You will hear people have been talking about it for many, many years. So what actually is it? I mean, and it's really important that we get ourselves in the frame of mind of what is large-scale change before we look at the large-scale change model, which is the thinking tool for it that helps us through it. So it was developed by the NHS Institute many, many years ago, 7 years ago, if not long, slightly longer now. And over 70 delegates from across the UK were invited to go on a year-long programme to learn about large-scale change, to go away and try it, to adapt it, to influence it, and to use it, and to use it on their transformational change programs. And that's what I did. I went with a team of, there were 6 of us from the Northwest, and we applied it to an alcohol harm reduction program, which was a massive challenge for us and still remains a massive challenge for us here in the Northwest. And I'll share that example with you a little bit later on in the presentation. The large-scale change model was refreshed really recently, only in the last couple of months, and it was brilliant to be involved in that refresh along with lots and lots of other people from across the system. And I would really encourage you to click on the link after and follow and have a look at the guide if you haven't already. The beauty of it now being an e-learning guide is that you can link to lots and lots of case studies and other bits of leadership and change information that's out there. So I would really encourage you to go onto the e package now that's out there. Large-scale change is an umbrella of social systems and technological systems, and it's all brought into one model. Many of you will already be using lots of the tools that are in large-scale change, and lots of them are common sense. But the beauty of the large-scale change model is it brings it under one umbrella. So that's I think, the benefit of it. Large-scale change is about thinking in an emergent way. So we're going to allow the change, transformational change, to emerge in front of us along the way. And that's really challenging, but also exciting for some people. Very different way of thinking, and I think thinking back to Debbie Sorkin's input last week on systems leadership, the leaders of large-scale change need to think in a different way and lead in a different way, and we've all got opportunities to lead through distributed leadership. So, you know, that's just a different way of working, and we need to work in a very different way in the system to allow that to happen. And that's something we'll talk about later on in this presentation and in the masterclasses. And also on that slide, and I'd encourage you to have a look at it afterwards, is an annotation of a large-scale change that we produced about 5 or 6 years ago. Just a 3-minute video to explain what large-scale change is about. So what else do we mean by large-scale change? Well, there's a brilliant metaphor that was devised in the original academy, which was called the village and river metaphor. And basically, large-scale change is about doing something fundamentally different than the status quo today. If we continue to do what we're doing today in today's current climate, we are not going to achieve the challenges financially, systems-wise, delivery-wise, to achieve what we need to do to respond to the demand that we've got. And the way to think about it is that if we went to sleep today and we woke up in 5 years, whatever transformational change you're leading, we need that wow factor. We need people to wake up and come back and say, wow, that is fundamentally different to how it was 5 years ago. And a great metaphor is the village and river, and I've slightly adapted that because I'm really into space and the view from the International Space Station. And that pitch there is Winnipeg, under ice in Canada. And if we use it as a metaphor for a moment, Winnipeg, if you can see the middle of it there, there's a river running through it. And if you imagine that at some point in this metaphor, somebody wanted to regenerate the middle of Winnipeg and put in a whole new shopping centre, a great parkland, and completely change the way that it looked. But the river kept flooding, which meant that it could never happen. So somebody came up with this brilliant idea to say, let's dam that river and put a different course of the river around the outside of Winnipeg. And you can see to the right of that map the different course of that river. They didn't take away the river, they just dammed it and diverted it because it was a big part of the regeneration. But living through that, and well, first of all, making the decision to do that was, wow, fundamentally something different. Can you imagine the governance, the decisions, the public consultation that must have happened around it? And then it probably took about 10 years to do it. So living through it, you would have found you're living through lots and lots and lots of incremental changes, linear changes probably that were complicated because everybody knew what needed to happen. We needed to divert the river, we needed to divert a road, we needed to move traffic lights, we needed to move houses. All these things are massive changes, small incremental changes in a large-scale change. So hopefully that metaphor gets you to see that and helps you to see that large-scale change is fundamentally something different, diverting that river and regenerating that town centre. That's one metaphor. There's another way to look at large-scale change, and that basically is to think about these 3 dimensions. Now, this was a bit of a light bulb moment for me when I went on the Large-Scale Change Academy. I've been involved in change in so many ways in the police service before I went, and in health and local government before I went on the Large Scale Change Academy. But we looked at changing systems and processes. We looked at making change in the pervasiveness of the system. And we were working over big footprints, but we weren't thinking about pushing our thoughts down across bigger footprints, across huge geographical boundaries of organisations and people. So when we think about change, we've got to think about these 3 dimensions. Are you working in a small portion of the system or whole system? Are you working in a small ward or a small locality, or are you working across huge local authority footprints, huge financial trust footprints, if not across STP footprints now, huge geographical footprints? And the idea of large-scale change is that you push your thinking further and further down these axes there's no right or wrong, but push your thinking down them as big as you can. But the depth in the way that people think is the behavioural mindset shift that we need to consider, and without that, our large-scale change won't be sustainable. So we need to take people and the way that they behave and co-create the change with us along the way. And that, for me, is we often do change to people rather than take people with us on the change journey. So changing the current mindset and mindsets of people, both who are affected by or are affecting change, is really, really important as well. So there are 3 dimensions of change. And I just want to stop there and really ask a question. And I would really, at this point, ask you to use the annotation in your tick boxes. So in there should be an annotation and a kind of a loudspeaker, and in that area there should be a green tick. And what I'd like you to do is tick that box if you have been involved in change and you are now seeing that you have been involved in large-scale change. So you have been involved in changing whole systems, huge geographical and numbers of people and organisational reach, and you've been changing mindsets as well. Have you been involved in large-scale change and thinking along those 3 ways before or now? Is that what you're thinking? Rachel, can we have a look at that? Let's have a look. I'm not seeing that. Rachel, are you able to help me with this bit?
Yes, we're just waiting for people just to find that icon. But so far we've got a lot of yeses and a couple of no's. For those of you that can find the megaphone, it just appears just slightly above the chat box under where the panellists and the attendees are. It's quite a small button, but if you click that, you'll get the option to select the green ticks or the red crosses.
I need to have a little patience, don't I?
Yes.
That's superb. Yes, I know. The thing is, there's so many of you, which is absolutely fantastic. There's 326 of you talking right now. So I can see that the chat box, I'm really looking forward to catching up with it later and would love to hear from you offline. But it's brilliant to see where you're all from and such a diverse mix of organisations, which is just great. So I don't know whether we're kind of ready with any results on that. See what we've got.
Yes, we've got an awful lot of people saying yes.
Oh, that's good.
A few no's, but the majority is yes.
That's brilliant. And I think what that's telling us is that the people that are involved in this WebEx and who are leading and involved in transformational change are working in exactly the right place. So we're working across whole systems, we're working across huge geographical boundaries and numbers of organisations, and we are ensuring that people are involved in the change too. And I think that's a fundamental shift in our thinking from, say, 8 to 10 years ago. So that's brilliant. So that's really, really helpful to know that. Thank you very much for giving me that feedback. Okay, a great way to look at what large-scale change is to look at what it isn't. So if we look at what large-scale change isn't, it might help with thinking about what large-scale change is. So large-scale change isn't about just rearranging, changing structures. And my analogy for this is, and my metaphor for this is that if you imagine Blackpool Beach, because I'm in the northwest, so we'll choose Blackpool, and they've got hundreds and hundreds of deck chairs, all lined up in lines, in colour order, red at the front, blue in the middle, green at the back, all facing the sea. And somebody comes along to Blackpool and thinks, I want to regenerate the tourism and the diversity of use on Blackpool Beach. What we'll do is we'll move the deck chairs. We'll mix all the colours up, we'll put them in circles, and we'll face them in a different direction under the south pier. And we'll just rearrange the deck chairs, and that will be okay. Can you imagine the consignation around that in terms of, I've been going to Blackpool for 25 years with my auntie, and we've always sat on the red chairs on the front row facing the beach next to Harold and Hilda. So we're not happy with that changes in deck chairs. The deck chair attendant, who suddenly has to put all these deck chairs in a different place, hasn't got the tools or equipment to do it, and wasn't consulted, like the public weren't consulted, in where the deck chairs could have been put. So they're really resistant to this change. So the best way to have done that would have been to share the vision, which was about regenerating the use of the beach, do the consultation with the public and the deck chair attendant and everybody else to say, where would be best to put these deck chairs? and then give the tools for the deck chair attendant to move them another mile down the beach, like a nice beach buggy or something like that. So don't just rearrange structures. Hope you like that analogy. And don't just change processes. So obviously what we're doing at the moment is looking at lots and lots of new pathways around getting people from acute secondary care back into community care. That's happening a lot in some of the process change. You'll all be involved in lots and lots of different process changes as well. But if we just create new pathways without the consultation of the public or dealing with the clinical governance, for example, then those pathways may not be the right pathways and they may not have the security around them that we need. So don't just change process as well. And then don't just attempt to alter behaviours without affecting the structures and processes too. And a really good example of this, which actually came from a totally different scenario, is hand washing in the NHS. So that was introduced in my very simple terms to eradicate hospital-acquired infections, and everybody was asked to wash their hands and roll up their sleeves. And we put in sinks, and we started to put in hand sanitisers. But then the public changed their attitude to hand washing, and then there was this demand from the public that came out that said, well, we want them in dentists, we want them in doctor's surgeries, we want them in service stations, in fact, we want them everywhere. But actually, then if we get this public ask, or we get the workforce ask for something different because we've changed behaviours, if we don't put the systems and processes in place to support that, then obviously we create an unhappy workforce and members of the public. So don't just change structures, don't just change processes, don't just change and over-promise in behaviours. You've got to do all three, and that's absolutely vital for sustainable change. I hope you like those kind of three scenarios, and I'll come back to that later. So how are we all feeling? There's loads of chatter going on in the box, which I can't follow because I'm concentrating on sharing thoughts with you, but I want it to be interactive. So I'm going to come to Elaine and Ian. What kind of things are being said in the chat box?
Hi, Ali. Yeah, so lots of really interactive chat going in the box, and people are really liking the metaphors. I think it's helping people to really kind of get to grips with what is large-scale change and what's the difference around large-scale change that we need to think about. Stephen Inns has raised a question saying, actually, in your view, Ali, what's the difference between service improvement and transformation?
Ooh, that's a really good question. So, I mean, this can be really controversial. I think service improvement could be about just changing structures and process. If you don't ask the service users what improvement means to them, and service delivery, so those delivering the service, what improvement would look like to them. So sometimes we try and improve services through moving them, moving the location, for example, or changing the pathway to get there. But unless that's done in co-creation and co-design with the service users and those that are delivering the services, I think that's one fundamental difference. And I'd like to have, great to have a chat about that. My other thoughts are transformation is what do those services look like in 5 years' time? So that's the transformational thinking. So actually services, the transformation of the service might mean less of something rather than more of something. So it might be less services, for example, in hospital and more in community care, or less services I suppose, for example, going back to my policing days, we all had custody suites and lots of custody suites in different police stations. Then we ended up with massive custody suites holding, 50 to 100 prisoners way away from police stations, and that's where the best delivery of service was given. So that's an example from a different sector, but an example from the health sector could be something very similar as well, so taking services to a very fundamentally different place. I don't know if there's any reaction to that at all, Elaine.
Well, it actually fits with some comments that are in the chat box, Ali, from a couple of delegates. So great insight from Lucy and Kathy here. Because I just sort of feedback to folk that might not be able to see the chat what they were saying. Lucy Purcell was saying co-design and co-production are the only way forward. Involve users and staff right from the beginning. And I think you've just illustrated that, haven't you, Ali, in what you were just saying there. Yeah. And it was backed up beautifully by Kathy Walsh, who before that had said, actually, going back to your deck chairs analogy, shouldn't we be asking the people, if they want the deck chairs moving, or do they actually want a lounger? It could be something fundamentally different. So I think you're getting some consensus in the chat box at the minute. Ian, are you spotting anything else?
same points that you were mentioning there, Elaine. You've definitely started a good discussion around the difference between transformation and service improvement amongst the delegates, with all manner of interesting views about how that can be conceptualized and whether they are the same thing or different at all.
Yeah.
Also, some interesting points from folks earlier on the breadth of things that they're working on and where people are from. We've got people from, some of our colleagues from NHS England and NHS Digital, Scotland, Wales. I've seen a delegate from the Isle of Wight. Hello. And people worked on really fascinating things, including one that caught my eye, which was very interesting, was system-wide patient flow, which I found very interesting. So I'd like to hear a little bit more about that from that delegate. So lots of interesting stuff for sure that people are working on.
Oh my gosh, I'm trying to keep up with this chat. Brilliant way somebody's just said, and I couldn't catch the name, sorry. But transformation is fundamentally doing things differently, even different organisations and people doing things differently. Improvement will be one of the outcomes. Love that. Absolutely great way. Just one of the outcomes will be improvement. So that's great. I am totally going to ask permission to use the lounger extension on the deck chairs because I love that. Because
it's so good, isn't it?
Yeah, and then we can go on to what colour will we have stripes? There we go. Whoa.
Yeah.
Okay, so superb. Please keep your comments coming in. I love the debate that's going on about the difference between improvement and transformation and all the attitudes and about getting people involved. For me, co-creation comes before co-production because production is we kind of know what we're doing, whereas creation is the innovation. So I think there is that kind of journey that we need to go on. So that's just brilliant. Okay, so you all seem to be feeling okay. If anybody's not, then please put your hand up too. But let's move on to the model because I'm really conscious of time. So now we know what large-scale change is. It's that fundamental different future state across huge geographical reach and size and the whole system, but it involves people. And it's that wow factor. Let's have a look at the model. Now, the large-scale change model has two ways of being talked about. There's a working definition, but if you're somebody like me who loves pictures, I'm going to show you that. That's coming, don't panic. But some people like to have the word definition, and we'll just go through that because I think this gives the flavour in words of how I think this is such an energising area to work. Yes, it's difficult. Yes, we need massive personal resilience, and I'm sure that will come up as one of our challenges. But large-scale change fundamentally is emergent. We don't know what transformation necessarily looks like at this point, and we're going to allow it to emerge and adapt and change as we go. We're going to learn from the things that don't work, and we're not going to necessarily criticise, and we're definitely not going to, punish if things don't work. We are going to learn from them, and we are going to change and adapt. At the same time, of course, we have to manage that polarity of governance and risk. That's all in the mix of this complex change. But it's about moving large collections of individuals, groups and organisations to a vision of fundamentally something new, but a new future state. So we could talk for weeks and days, and you could spend thousands of pounds with consultancy organisations trying to create the best vision. What I have learned on this process is that you will have a vision, but one vision will not fit everybody because you will never have every word in there that ticks all the boxes of all the distributed organisations that you need. So you need a very simple vision that people can imagine and see and know where they're going to, and then they will frame and reframe it and reframe it, and they will reshape it and re-talk about it in many, many different ways. And we'll talk about framing shortly because that's really important to large-scale change. But you have a vision, so people know where they're going. We haven't got a route map, but we've got a direction. But you create that route map by creating high leverage key themes. So under your vision, you have big, massive key pieces of work that need to happen, that when they are all delivered, which is going to take time and it's going to all happen at different times because this is transformational change, so it's going to take years, or an undefined amount of time, but when they're all delivered, you will have achieved your vision, if that not has changed anyway. It requires massive distributed leadership. So in all the big multiple networks that we've got going on now and all the different organisations, lots of people will be working on their day jobs, but their day jobs will be part of a large-scale change, and therefore that is your distributed leadership. So this is about creating many, many people and many, many responsibilities and opportunities for conversations, change and leadership. And it's about massive and active engagement. So there's a big word for us, active. This isn't about sitting back for 3 months and then turning up to a meeting and then responding to that meeting the night before, which traditionally a lot of us do. And I'm sure some of you are giggling now and hopefully nodding your heads, because I'm putting my hand up and saying, I've been in that system where we work in quarterly cycles. This is about active engagement where we are working on the large-scale change efforts every day. And the reason that is because it's our day job. So everybody is working actively towards achieving the vision. And it's about creating an engagement with lots and lots of stakeholders. So your stakeholder maps should be populated with hundreds of people, hundreds of organisations. Prioritising them is a tool that we introduced in the masterclass, but actually there should be lots of people, and there should be interdependencies between your stakeholders, and lots and lots of interaction across all your key themes. But it's about mutually reinforcing the changes across multiple systems and processes. So it's about multiple system change, multiple process change, and multiple attitudes, beliefs, and behaviour change. And that's where we forget sustainability, and sustainability becomes largely inherent. So I think there's something here about really understanding, you know, that this is huge. There's no full stops in that one large sentence. So a large sentence leads to large scale change. But let's have a look at the model. So to explain the model, we start in the top right hand corner. But when I've explained it, I'm going to ask you where you think you are currently in that model. And so as I'm talking you through it, maybe have a think about, oh, that's me, or that's where I need to get to, or that's where I've been. So let's start in the top right-hand corner, the identifications we need for change. Yes, any great transformational change would come from a wow moment where we say, we need to do this huge change, and permission starts now, and we start here. Well, that rarely happens. In fact, I've never really seen that happen. So a need for change often comes out of lots and lots of different challenges, but it can come out of a government directive, new leadership, new funding. So there is a need for change, and it's the way that you are able to describe that change in many, many different ways by moving down into the framing box that is the starting point for you. And I would encourage people, when I'm coaching large-scale change, to stay in that need for change and framing box for as long as possible while you are building up many, many, many different ways of talking about your change and the need for that change, to be able to engage all your stakeholders as possible. So I think traditionally in the past we would have had a reason, 1 or 2 reasons for change, and we would have gone straight into it. And we would have expected everybody to follow us, or we would have just commanded and controlled it to happen. Well, that's not social system change, and that's not transformational change. So there's a big need for change, and we are going to frame it in many, many ways. Then we go into what I call the heart of the model, and that's the round circle, and that's your framing, you're engaging, and you're making pragmatic changes. Now, you may have started your large-scale change because you're already making pragmatic changes. You're already probably all working really hard on your change programs, and so therefore you are making pragmatic changes. So you are making lots and lots of changes across multiple systems and processes already. But to go forwards in large-scale change, you often have to go backwards. So let's go backwards around that circle. Who is engaged and is in your distributed leadership for your change? How are you going to engage these people? What are you going to say to them, which is going backwards against the framing, in order that they, you know, work with you to make those pragmatic changes? So to go forward around that circle many, many times, and that's your delivery, that's your change happening in large-scale change, you have to go to backwards. And the more pragmatic changes you can get going across the multiple systems to achieve those big themes, to achieve your vision, the bigger, the bolder, the further, the faster your change program will emerge and transform in front of you. But that's going to mean that you need to engage lots and lots of people all the time, and you need to be talking to them in different ways. Now, you know that your large-scale change effort is successful and is essential, and there is a need for it to continue when you are continually attracting interest from new people or from people in a different way that are already within your system. And you continue to attract interest by framing in different ways. So, you know, quite often in change, we just talk, we hold frames in our mind and we talk about them too often and for too long. And I'll give you an example of that shortly. But what I would encourage you to do is, can you come up with a new framing every week for something, or every month for something that you are doing differently? Therefore, you are showing your progress. Therefore, you are attracting new interest. And therefore, you're keeping the energy going because you're starting to see the changes that you're achieving as well. So to deliver large-scale change, you go round and round. So this isn't a linear model. This isn't a long process of change. This is going round and round and round, changing many, many times. And I don't know how long you're going to stay in that circle for. For the first large-scale change program I led, we stayed in there for 7 years. Now, lots of you can now put wow and oh my goodness and oh my good in the box, but we stayed there for 7 years. And then we plateaued. I'm going to come on to that shortly. For 2 years, and now a new leadership for change around that is emerging. So that hasn't actually stopped, it's just that we're in a different cycle. So you're going around that cycle many, many times. After some time, that might be a month, a year, 10 years, you get kicked out or you pull yourself out, you drive yourself out, hopefully you come out of that cycle, and there are 3 possible outcomes which we call settling in. The first one is that you run out of energy. This is all about, from my perspective, possibly because your large-scale change wasn't really a large-scale change, or it wasn't set up in the right way, or it was mandated in the wrong way. Maybe it was set up by a specific leader who's left and therefore it wasn't sustainable. Maybe it was set up by specific funding which wasn't sustainable beyond that funding. Maybe your change actually had proven something and it was time for it to end, but it had run out of energy. I think one of the things I'd like to put in there is that I'm really keen that change doesn't run out of energy because our personal resilience isn't maintained. And there's one thing I would say about, and we got asked a lot in the last webinar that I led, how do you maintain your personal resilience through this really complex change? Well, that for me is about teamwork, creating an engine room around you, surrounding yourself by like-minded people that are all working on the same change and creating distributed leadership. That keeps the engine going, that keeps the energy in the engine room, but we can talk about that at a later time in different masterclasses. Another possible outcome is that you go into a plateau. Now for me, I think that's a positive place if you don't run out of energy. So if you go into a plateau and then run out of energy, then the plateau's not so good, is it? But if you go into a plateau while a prototype is settling in, whilst you're taking a breath, whilst you need time, whilst your leaders are embedding, whilst your system change is embedding, then that's a really positive place to be. How you get out of the plateau is really important. You either move into sustainable norm, or you might need to go back into the inner cycle and do more and more change. So the plateau for me is a really positive place. And the last outcome is a sustainable norm emerges from your transformational change program, so that we know that you've settled in and that you've got sustainability. Now, sometimes after that, we have to live with the consequences, positive and negative, and some of them may kickstart a new need for change. Really good example of that in the tobacco agenda and in the alcohol agenda. I'll talk about alcohol because I know about it more. But do you remember we created the cafe culture and we created 24-hour licensing? But actually, what we did is we changed the systems and processes by creating new licenses and 24-hour licensing, but we didn't necessarily consider the impact or co-create the systems and processes around that to deal with people who then were going to use alcohol in a very, very different way. And the consequence of the 24-hour licensing is a lot of the work you're seeing around alcohol harm reduction now, which is about changing systems and processes, looking at minimum unit price, changing price and promotion. I will go on to that. So what was a positive change ended up kicking out really something that needed another large-scale change to fix it. So at this stage, we're on slide 15. What I would really like you to do now, if you can, is to use your annotation again and use the pointing tool and drag it to the place of where you think you are in your large-scale change effort. So this is so Joe Murray straight in there. There goes Yvette. Peter, well done, brilliant. So it's great to see. So lots of you are working in the heart of the model. I'm hoping this gets covered in arrows. Somebody's off the side. Okay, so this is looking great. So some of you ran out of energy. Some of you are in the identification of need for change stage. Lots of you are in that framing. That's brilliant. Lots of you are in the heart of the model. Amanda, that's great. Thank you for sharing that you're living with some of the consequences. I hope some of those are really brilliant. Some of them might be challenging. This is superb. So when we used to talk about large-scale change, we used to say, right, you start at the identification for need for change. I changed that now, and I often talk about you can join the large-scale change model in any place. because we're all in the middle and immersed in large-scale change. We've got some people drawing on the screen, lovely. Okay. Brilliant. Okay, so what that's showing me is that lots of you at the start, or you've identified a need for change and you're in that framing stage. I would encourage you to stay there for as long as possible, framing and reframing what you're doing. To engage lots and lots of people is really important, but also some of you are all in the settling in period. So I think that's a really positive place to be if you've gone in there and then some of you are living with the consequences. So that's superb. Can we clear that, Rachel, and can I move on? Okay. So I'm conscious of time, so I want to carry on and give you an example, really. So we know that 33% of project change programs fail. 33% of them meet their objectives, some of them, and 33% meet all of them. And I'll come on to my thoughts on why that happens in a moment. So you're all working in public sector organisations, and the reason that I think that this is even more challenging now than when it was when some of those statistics came out is we're dealing with more increasing demands. There is less money in the system and there are less resources, so we need to do something fundamentally different. We have a history of patchy change. Change isn't particularly a positive word anymore, and actually we talked about change failing rather than learning from change. So we've got to change that rhetoric, and we've got to look at talking in a very different way, because we have got to still change. So we've got to talk about change in a different way. But there's a shift from organisation to whole systems, but what we do see is people are still working in their siloed organisations rather than across multiple organisations, and there are lots of reasons for that, and we know it happens and we know it's happening, but we've got to challenge that as transformational change leaders. And we recognise that transformation requires a totally different new set of skills, and those that joined Debbie Thorkin's Systems Leadership Input last week will have heard about them, and the masterclasses we spend a really good day talking about systems leadership and what it's like to be a different type of systems leader and what skills you need. So this is my thoughts on why large-scale change doesn't work. There's no mandate. You haven't got a mandate for that change, whether that is a systems mandate or a personal people mandate. You need a mixture of both. You've got to have a mandate to be working in this way, and you need great leadership and systems leadership around you, and you need resources. You've got to create an engine room of resources. If you are sat as a lone person leading change, and you don't have the resources around you, then 88% of you, from research that I have done, won't achieve the large-scale change that you are trying to achieve. You are going to need resources around you, and you're going to need that engine room, which I believe is the landing pad. And fundamentally, the significant one for me about large-scale change doesn't work is because there isn't enough patience in the system. So if you've been commissioned to deliver a transformational change program in 3 months, that's not transformational change. That's a complicated change. And we need to learn and find the tools to be able to push back to get people thinking differently about transformational change. Of course, we have to feed the change along the way. We've got to share our early successes, quick wins, opportunities and emergence stories. But we've got to encourage people to be patient, because this is going to take time. And I think the questions to ask ourselves is that what can I do differently as a change leader to ensure that all those are in place to help me be in the best place to lead transformational change that I can? How can I work differently across systems? Who do I need to work differently with? What tools and techniques can help me? And who can help me? So this is that personal resilience question to ask ourselves. And I hope that that slide gives you a conversation not only to have with yourselves, but also with people around you around a successful model for a transformational change team. So there are tools that we are going to share in the masterclasses that are involved in the large-scale change program. Some of you may have heard about driver diagrams. Some of you may have heard about stakeholder analysis tools where we really understand our stakeholders. There are tools that help us create momentum, and then there are leadership tools. So again, this is another interactive part. I would really like you to put an arrowhead on the tools there that you have used the most in your current practice. Straight in there. So we've got people using driver diagrams, so that's brilliant. We've got momentum tools being used and leadership tools. And what I really like, what's emerging straight away, is that lots of you are really trying to understand your stakeholders and analysing them, and that is crucial. So I think gone are the days where we go into a meeting without thinking and preparing for that meeting. Who's going to be in that room? What are they thinking? How are they going to respond to what I'm saying? And really understanding what's in it for them, because everybody is going to respond depending on what's in it for them. That's the reality. This is superb. So lots of you are using the tools. And there are some brilliant ones out there. There are lots that we're going to share with you in the masterclasses, but there are more out there in the plethora of change, and there's lots of links to them in the large-scale change guide. So thank you for that, and thank you for that interaction. I'm going to move on now. Okay, so this is a driver diagram that I created with a smoke-free organisation a number of years ago, Tobacco-Free Futures, and what it shows is a driver diagram in action leading to massive change. So they had a 10-year vision, make smoking history for children, and in order to get engagement and to allow people to see how they belonged in that, they needed to create a one-year vision. But even off that one-year vision, their primary drivers, their key themes that needed to happen were massive pieces of work. So if you just take that top big piece of work and I show you how that gets broken up, and I'll just explain, that gets broken down, into lots and lots and lots of different huge pieces of work. So this is the driver diagram that we talk more about in the masterclasses, and hopefully lots of you will be able to see your large-scale change efforts in a kind of that big tree that's growing and growing and growing and spreading out. So that's an example of a driver diagram. These are examples of stakeholder and stakeholder analysis tools that we use. So we really start to understand who are our stakeholders, where are they in terms of committing to working on the programme, are they being helpful or unhelpful, or do we need to engage more? What are our stakeholders thinking and helping and doing? So these are some of the large-scale change tools that we use to help us really analyse our stakeholders that we introduce you to in the masterclass sessions. And these are our creating momentum tools. So rather than thinking about working in quarterly cycles, we work in 30, 60, 90-day cycles, and we take two-step down thinking. And the reason that these cycles work is that it gives us foresight rather than hindsight, and it allows us and challenges us to do work in 30-day chunks, which really gets momentum going. And some of you may already work in that way. If not, I would encourage you to come to the masterclasses, learn about them, or go online and learn about them, and really start to think differently about how you create momentum in the work that you're doing. And then leadership. So Paul Fezick, who is one of the authors of Large Scale Change, really comes up with a great quote where you can influence others as a leader, but distributed leadership brings about the massive change that you need. And leadership is about influence, not about role. So this isn't a hierarchical leadership model. This is about influence. And everybody who has a part to play in the large scale change effort is a leader. And it's really important to understand the leadership traits that are needed in large-scale change, which we talk about in the systems leadership part of the programme. Okay, I want to give you a brief example of my journey before we start to talk a little bit more and be a bit more interactive. So where did it all begin? So when we went to the first Academy for Large Scale Change, we were a team of Regional Director of Public Health, Director of Nursing of Acute Trust, Chief Executive of Acute Trust, local authority, commissioners, providers, and change leaders. And we had to reduce alcohol-related harm, and there was a government, our need for change came from a government directive to reduce alcohol-related hospital admissions by 2%. Some of you may think that that's tiny, but at the time that was a massive challenge. We pushed our challenge and asked people to join us in this challenge and delivering this challenge to 5%. So that was our fundamental future state. We framed our challenge as we wanted to create a safer, healthier Northwest free from alcohol harm. So we didn't talk about reducing this or reducing that. We had a vision to create a safer, healthier Northwest free from alcohol harm. This was our first set of distributed leaders. These are massive organisations, and you can see there's health, social care, police, fire, third sector organisations, charity sector in there. If I put a map of distributed leadership now, you would see hundreds of different organisations that ended up being involved in the change as distributed leaders. This was our first framing, cost one. This was the first hard-hitting one. So this basically, what we were able to say is the national average that a person spends, say, for example, through their council tax, is £387 a year on on cleaning up alcohol-related harm. So that's you and I sat at home now. That's how much we were spending 8 years ago. Then in the northwest, that went up to 439, and you can see in parts of the northwest that went up even more. So we had a significant financial challenge, and we were the worst in the country. Shortly followed by the northeast, and we ebbed and flowed around that. So we had a financial framing. We were then able to reframe that through the lens of looking at one family in particular, and every one of those boxes is an alcohol intervention with a family, a mother, 3 sons, and a 14-year-old pregnant daughter that has an alcohol issue, and each one of those boxes over a year is an intervention, either universal, targeted, or reactive response to an alcohol-related harm. So that was another framing. So we went from national figures to regional figures to local figures to a family that we can all imagine. We then put that family figures around the table of partners. So there you can see your distributed leadership of organisations and how much it was costing them individually. That was another frame. And then we had another frame where we were showing how much unplanned reactive responses all the organisations were doing to alcohol-related harms. And you can see that if our fundamental new future state was to make a safer, healthy and also free from alcohol harm, we had to grow the targeted interventions from 7% and reduce the around about 80% reactive targeted rate. And that was our challenge. So they were our first framings. Another frame we had with one person every 4 minutes is go to A&E because of an alcohol-related harm. So we had lots and lots of layers, and it was so important to get the stories behind that. The stories really enforce your framing. This was our second driver diagram, and the reason I'm sharing this one with you is that our first one was put in place, was co-created predominantly with health and primary care trusts at the time. 4 years later, our set of leaders changed to local authorities and police and crime commissioners and health as well. And our drivers never changed. You can see our 5 drivers on the left never changed, but our leadership changed. And what I want to show you through this driver diagram is that the primary driver number 4, which was all about young people, stayed blank for 4 to 5 years. And the reason for that is because we didn't have the mandate to do massive fundamental change in that area at that time. But we didn't take it off. We wanted to show it, and we used it as framing to say, actually, we're doing all this other work, but what about young people? So it was actually positive to have a blank in our driver diagram. But also what it shows is that areas of our fundamental change and people change and move at different scale and paces, because what happened was, after 5 years, we then were able to get a framing around young people. We got a mandate for change by different leadership through health and social care, and we were able to reframe that one driver around, let's look again at alcohol. Alcohol and childhood don't mix. So our policy asks haven't changed, and here they are. Our policy asks from day one around reducing the price of alcohol and minimum unit price, restricting marketing on alcohol, and getting public health as a 5th licensing objective is some of the big policy asks. When we started off our large-scale change programme, they were our policy asks. They are the same policy asks that are emerging out of the system today, which is 9 years on. But we weren't able to talk about young people until 5 years into our programme, when we had the right framing and the right distributed leaders and the right mandate for change around the room. So what I wanted to do in showing you that is that large-scale change, it takes time, and we have to be really patient around young people until we had the right mandate, the right resources and the right framing. But our original vision never changed. Our leadership changed, and our distributed leadership changed over those 7 years. It's then plateaued for a couple of years, but is currently emerging again through different avenues. So that's the patience that we need to see. That was our reframing, and it actually, you know, it was brilliant to get one. It was really exciting. It really reignited the system around the alcohol harm reduction agenda, because we were able to bring a whole new audience around children, young people, education into the system. So these are some of the programs of large-scale change that I've either worked on or helped and supported. And you can see there are many, many framings. So there's a question I want to ask before we come to an end, really, and pause and just say, framing, and I know a lot of you have put framing up there, that we need to spend more time on framing. Framing, is that a conscious or subconscious way of working? And I'd like just to hear some chat in the feedback box. Do you consciously frame and reframe, or is it just something subconscious that you do now? And there isn't a right or wrong, it's just really showing you the importance of framing, and I really wanted to spend some time on that today. So if you could share your thoughts on framing and what we've talked about, and whether you consciously or subconsciously do it. So I'm getting great feedback. Subconsciously you do it. Consciously you do it. Oh my goodness, it's whizzing up now. I think for those of you who are saying that you subconsciously do it, that's brilliant because it's just the way that you work. If you can bring that into your conscious mind more and more often and create new framings, as I said earlier, and new ways of talking about your program, I think that you will create new momentum, attract new interest, and be able to engage lots and lots of people. You may already be doing that. And if you're doing it consciously, I hope it's really working for you, and I hope you're seeing the benefits, because it's something that we didn't used to do. I certainly didn't do so much of, and now I walk around with, if you hear me talk in the masterclasses, I walk around with a holster around me of framing and asks. So your holster needs, and you need to imagine that the lift door opens or you get off a train and you meet somebody and you've got 30 seconds and you need a bag, a holster of frames to be able to say what you're doing and what you want them to do to help you to join in your engine room of distributed leaders. Okay, any feedback on that, Elaine? Can you give me any feedback at all?
Yeah, you've basically brought the chat bot totally alive, Ali. People have really valued the framing and reframing case study and bringing that to life. So I think we've almost got an equal balance here of conscious and unconscious use of framing and reframing. But people are sort of really commenting earlier before you asked that question, actually, just how useful it is to see how you've used that example of reframing in a different circumstance and how you had to do that over a large period of time. Kathy Walsh put a comment in saying she loves seeing how the driver diagram contributed to the whole of that program for you, alongside the use of framing, and how important it is bringing all of these large-scale change approaches together to help keep you sane, I think, as a leader of all of this.
And I think the really great word you used there, Elaine, was alongside each other. So I don't think there is start with one and work through and then that's job done. I think that they need to sit, obviously you work through them and there's a journey through them, but they need to be alongside each other. And you constantly need to be reflecting back to your driver diagram and thinking, how am I going to frame that? How am I going to frame that? And I think for me, the most powerful framing that we did was take a national financial figure, make it local and then super local, and then into a family and then into a person, so people can really, and I think for today's challenges that's even more important, especially when we're talking about, and lots of it is around community care and around about people and people-centered focus. So that's really great feedback, thank you. So I'll just share my top tips quickly before we finish, is that okay?
Yep.
Okay. So top tips for me, for you to take away, and I know this has been a bit of a whirlwind and we have a lot to get through, but there's lots of you interacting, which is brilliant. So create space and time for your preparatory work. Stay in that identification and need for change and framing for as long as possible. Because once you start talking about your large-scale change and you start to engage people, people will get really thirsty for more and more. So the more framings you have at that preparatory stage, the more you're going to be able to get momentum going really quickly. Ensure there's fertile ground for change. And when I say that, I'm talking about have a look around you. Have you got the mandate? Have you got the resources? Have you got all the sides of your field, of your fertile ground, secure and stable? Or somebody, in my analogy, have you left a gate open or somebody opened the gate and so it's, you've got some challenges? Make sure you've got that real fertile ground for change. Large-scale change is really reliant on people, and let's be honest, we can make it or we can break it. So this is so reliant on building trust and understanding between your distributed leaders, building relationships across organisational boundaries, and also with the public, service users, members of the community. It's so reliant on people. That's a social bit of change. And large-scale change is learnt in action. You're all sharing your pains and gains and challenges and opportunities here. We've got to use the collaborative space that NHS England have given you here to learn how to really create this large-scale change movement that we need, because it truly is learnt in action. It's very hard to lift it off a page, and it's better to use it and to try it and learn from how it's felt and use it in the round. So what could you do next? Create stories for your change. What is your analogy? Are you able to have a Blackpool Beach analogy around why we don't change structures? Do you have a metaphor to tell a story of your change, like I do about Winnipeg? Are you able to really get people to pictorially see and where you're going to, and the analogies to help you think about that? And you know, talk in 30 days. 30, 60, 90-day cycles of action. And, you know, if you're going to do anything, we talk about two-step down thinking. If you're going to do anything in the next 30 days, what are you going to do in the next 30 hours or 30 minutes after this webinar to really get going and keep hopefully the energy that we've built here going around the large-scale change model. And I'm going to end there and pass back to Elaine to tell you what's next, really. And thank you for all your interaction. I'm really looking forward to having a read through it, and about Winnie the Pooh I've just seen. So thank you, everyone, and thank you, Elaine. I'll pass that to you.
Thanks so much, Ali, and thanks everybody. I don't know where that hour has gone. It's completely flown, as has the chat box. So we've just bobbed Ali's contact details into the chat box. Just before you all disappear off, and we will wrap up before the 1:30 button moves across, you can connect with us through the collaboration space. So if you want to engage with Ali and learn more, or have a conversation with each other, please do connect to our collaboration space. You can see it on the screen now, and we'll pop that link for you in the chat box. Rachel can help you to join if you haven't joined already. Next week, we will be having a session on the change model. That's going to be led by myself and Michael, who's been on the call today, but not had a chance to speak just yet. So please do join in if you can. And if you can take a minute to complete our post-WebEx survey, that will allow you to access the CPD points if you complete the learning survey, and will help us to carry on making these sessions even better. Finally, there's been lots of questions about the masterclasses. We're just designing those up at the moment, and we'll make sure all of you receive a communication from us to let you know how you can apply to be part of the masterclasses. If you'd like to come along and spend 1 or 2 days with us learning a lot more about this learning in action on large-scale change. Okay, so huge thanks, Ali, and thank you, everybody, and have a great afternoon.